Good afternoon, everybody. Thank you to the one that have invited me, so the organizer, to Norbert, but thank you all of you that are still here when it's still so nice weather here in Malta, and I came from rainy Brussels this morning, so it's really a difference. So I'm here representing the Innovative Medicine Initiative, and I will start telling you a little bit so I don't have any conflict here. So what is the Innovative Medicine Initiative? So it's the largest European partnership from health, which is funded, and our members are, on one side, the founder member is the European Commission through the Horizon 2020 program, and on the other side, the European Federation of Pharmaceutical Industry and Association via its members, the pharmaceutical industry, which provide in-kind resources for 2.5 billion euro that are matching with the 2.5 billion that are provided by the Horizon 2020 programs. And what is our mission, really? Our mission is to be there to facilitate open collaboration in research to advance the development and accelerate patient access to personalized medicines for the health and well-being of all, and especially in areas of unmet medical need. And clearly, pain is an area of very much unmet need. We are here because of the social burden of especially chronic pain. We know, I found this very recent statistic which confirm this, and as other speakers already have said, the point that there is so many people that are really affected. I think everybody knows one. And of course, with the aging society, this is increasing as a problem, but we must not forget that also in young people, we have this problem, and sometimes in specific populations, we can even have 30% of young people that have pain. So this is not to be forgotten. And this is a real big problem for society and for the individual, because for the individual, we have cases where up to 35% of patients, they say that their pain is unbearable. And on the other side, we know that, as has been already said by many speakers, that the fact to have pain, and in particular chronic pain, influence job perspective and might lead to other type of medical condition, especially psychiatric disorders. And so in IMI, how we work, I think to work really you have to have a little bit of a look at our budget, which is rather, let's say, complex looking, because we have on one side, we have funding that come from the Horizon 2020 program, and this is funding that we provide in our project for university, from small, medium-sized enterprise, with patient groups and other stakeholders that are our beneficiaries. But we cannot spend a single cent of the Horizon 2020 money if we first don't have the resource that are committed by the FPA industries that participated to our project. And also now we also have some possibility to have leverage resources not only with the pharmaceutical industry but other type of industry that can join the FPA organization, but or other type of organization, like for example charities, funding, other funding organization, like for example we have co-funding in some initiative with the Gate Foundation. But what we do, we fund a collaborative project, which create each project is a public-private partnership, where we have industry and academic, patient organization, medical doctors, you name it, depending on the type of project, working together and really creating in each project is a small public-private partnership, really a cross-sector community, which this number for already old, 2016, but they show that they are for very different stakeholders, from, of course, academics, but also small and medium-sized enterprise, industry members, and patient organization, and also other stakeholders, among which also regulator. And the point that they all have to work together in a spirit of open collaboration, really to try to improve the development of medicine, because we are called the Innovative Medicine Initiative, but also really to develop the very, let's say, the blue sky research that need then to be developed further to become really some innovative approaches that can be delivered to the patient and to the medical care and to the medical care providers. And here is a snapshot of the many areas that we fund. So you see that we fund many, many different areas. I would like to point your attention to brain disorders, because there is where also pain is included. And in the third part of our life cycle that was under FP7, called IMI1, around 10% of our budget went for this area. As you see, the big share went to infectious disorders, but that is because we really have to go with unmet need, and clearly this is a clear unmet need for everybody, I would say. But so why on earth it was decided to do IMI or IMI? Because really the drug developer can say that really if one wants to get a treatment to the patient, there is a problem, because this is a very complex process, it's very lengthy, it's very risky, it's very expensive, and unfortunately it's very inefficient. Therefore, and this is because really we still don't know very little about more condition, in particular pain, we still know very little about it. And when we do the clinical trial, when people do a clinical trial, still there is not a very good adaptation of what has been the progress in clinical knowledge. And also regulatory pathway, regulatory science is in evolving and need to evolve more. And then if we think about pain, indeed this fit the bill perfectly, because indeed pain is very complex, come in many forms and facets, as is shown in this slide. We have acute pain, we have chronic pain, we have the transition between acute and chronic pain, we have different types of pain. So it's clearly complex. And also, if we think about treatment of pain, then many drugs that are used today, more generally, have been found 100 years ago. So not really innovative and new. And then on top of that, if we look at the success of treatment, we can say that around 1/3 of patients really are well treated. So we have really, really a lot of work to do. But why is it being so complex? Why so difficult? Because there is a very unpredictability between what is the cause of pain and what is the effect, so that this much more need to be learned. There are many potential different causes for example, a pain that can assume the same form. There is a challenge, therefore, to identify which patient can be really treated in a so-called personalized type of treatment. And also, when there is a drug development, we have to use animal models, which are very different from the patient situation, simply because an animal cannot tell you, I am in pain. So this is a big problem. And also, last but not least, since the high complexity of the biology of pain, clearly this has been hampering the possibility to identify a novel target. So there is a lot of work really to do, but really that's why pain really fit very well in the vision for the new IMI2, part of Horizon 2020, which is really to try to move from treatment for a population, the pain population that is so heterogeneous and various, really to try to a better, more individual and based on stratification of different group of people that hopefully will better respond to treatment and will also have much less side effects. And these slides, please, is not to read, but just to say that we have a very ambitious objective that will be given to us by our legislator, what we should do and what each project should do, but I think that even only a fraction of this objective could be fulfilled for pain, a lot of progress could be done. So I really hope, and we have now a very committed group that is working on this. But how we generate our project in IMI? So first of all, as I said, we cannot spend the public money if first we don't have a leveraging of resources that is really mainly, for example, people working in an industry around a specific challenge, something that a different type of industry. In our project, often we have many of the big players that work together, that decide that they need to work together for solve a problem that otherwise would never been solved. And they decided to commit resources for this. On the basis of that, we can sort of make a calculation in euro how much these resources are, And then we can open a call on the basis of a topic that has been written by the team that provided the resources, but have been also through a public consultation with our advisory body and with the European Commission. And there we have an open competition with a peer review where the best team that has responded to the topic is selected. Then this team is put together with the industry team, and they have to work and prepare a full proposal that get a go, no-go decision, again with peer evaluation, and at that point it gets funded by us. So clearly, and for us, for what is important, that is each of the initiative scale is really key. And scale can be funding, but can be also really the ability to leverage together all the different stakeholders that should really work together to solve this specific challenge. And really what we like to see is in our project is that outcome should hopefully be transformative for the industry, because we are there to help them in their business, but most importantly for the patient, and of course for the public in general, so that there is a clear public value that has to go beyond what is simply also important high impact publication. So we really would like to see something more than that coming out of our project. And indeed, in pain, we have all the opportunity to do this, because pain is really a multifactorial, multidimensional problematic that need a multidisciplinary and multi-stakeholder approach. And now I will give you a few examples. One is now from a project that is finished, the European project. It was an IMI project that was started at the very beginning of IMI and ran for 6 years. And this is a collaborative project, 25 stakeholders working together with some very complex objective and very ambitious objective. But the point is that working together, patient, academic, doctors, and industry, they really managed to deliver. So just to give you a snapshot, what they did, for example, they managed to lead an international consensus how to do preclinical studies that are so important for then the development of new treatment. They also managed to work on identify and translationally validate novel drug target. They conducted clinical trials to improve patient stratification. They developed tools to predict which patient could respond better to treatment than other, and also made some important work in understanding the placebo effect that is very important and valuable for reducing clinical trial failure. And last but not least, they started also to work with the regulators and have some interaction that have actually an impact, as I will show in a slightly bit later. But just to give you some examples. So really, I think European made some important work really to make people to understand that pain is actually a brain disease. And how they showed there, they did some imaging studies, for example, where they demonstrated that pain has some effect on the brain. Pain changes the structure of your brain, simply. So, which I think is clearly important and was really underestimated before. Also, what in European did also to look at the different type of response of patient with pain, and demonstrating that patient with different pain sensory phenotype, so patient, for example, that respond more to cold or to pressure pain or other type of pain, or they have a more response or less response, they also respond differently to drugs. And they could do that, and this clearly is a first important step to demonstrate that there really is possible then to have a new stratification for pain clinical trial. And then also what I think is very interesting, they also did some important work towards the prevention of the development of chronic pain, studying in particular patients that were undergoing different type of surgery, and trying to identify all the factors that are important why people develop chronic pain after surgery, since this is completely unpredictable and would be so important to know it before. And they could, of course, find out that certain type of surgical technique could be better than others for avoiding chronic pain, but also that really there are some psychological factors in the patient that can give you a good idea if this person will develop chronic pain or not. So clearly this is all very important information that can be used in the practice. Last but not least, of course, as already said, pain comes with a lot of comorbidity. And we have a psychiatric comorbidity, but a very important comorbidity is sleep disorder. And here we are really with the chicken and the egg problem, because indeed pain causes anxiety, causes depression, causes disturbed sleep, and sleep then increase pain. And in general, everything of this disturb quality of life. So it's clearly something that we have to learn much more, but to learn much more, we need to have models to do this. Also because if treatment has to be developed, that they have an effect also on this aspect of pain that's so important, we need to be able to do this. And in fact, for example, what they did in European, they could be develop an experimental models, both in human volunteer, where they have sleep deprived, and then they studied them very specifically on their effect on pain sensation, and also in experimental animal. And they could do exactly the same results, and also some pharmacological validation. So clearly this is a very important step that of course need to be developed much more, but they could maybe use to develop new treatment for the future. And then last but not least, European, as I said, also discussed more with the regulation. The regulator, they went to EMEA, EMA, they went to scientific advice, and the result indeed has been also used for the development of the new guideline that has been recently out. And now in IMI2, in the second part of IMI, pain is still very much in the focus. We have a very active pain industry team that has been quite recently funded, but still already quite busy. And really what is important is here we have all the major players in pain in Europe that sit around the table. These are competitors. Normally, they sit around the table and they discuss the major challenge that they have, where they say, hey, here we have to work together, otherwise we will never get out of this. And we need to get the best scientists in Europe, the best people that know about pain to work together with us. So that's indeed what they do. So they have to identify areas where they can work all together, and where, of course, there is a specific social value, because then they have to be part of an IMI project, so we have to demonstrate a European value to be able to be allowed to use taxpayer money for this. And then, of course, this should allow then the development of a portfolio, very concrete pain project, which will address all the different challenges. And this, as I said, will be sought in partnership with consortium of partners selected via open competitive calls, because, as I said, we handle public money, so we have to do it very carefully. And so, as my colleague already, Karuk, mentioned, the first project was this project called NGN PET, that is really trying to look at the fact that if we think about the brain, everybody thinks about the neurons. In the human brains, neurons are only 10% of the rest of the other cells. We have many other cells. They all interact together. They all network together. What is the importance of this for pain? We don't know. So what is the first step? Really to develop some tools in order to study this. And this is exactly what this project is doing, and is doing it both using preclinical species, so in animal models, but also using very innovative tools like inducible stem cells that are derived from patient, in order to have a fully translatable results that can be used then, hopefully, for the development of new treatment. And then last but not least, this is really hot from the news. We are just starting, we are in the process of developing a very important new project that will be a pain path platform, where by leveraging both public funding and funding in-kind resources from the industry, we have the 6 major players in pain in Europe all working together in this project. We will have around 25 million for pain. And there we will have actually a platform where we will have a team working at the patient-reported outcome measure for improving the management of acute and chronic pain. We will look how to improve the translatability of biomarker for pharmacodynamics, so for really to study the effectiveness of drug on the different part of the pain pathway, both in a healthy subject and in preclinical species, in order to accelerate the development of new drugs for a new treatment in general for pain. And then also, last but not least, we will look at the improvement of translation in chronic pelvic pain, which is really an area of very much unmet need, where there is really a good need of a lot of work. More ideas are also in the pipeline for the future, so there will be more coming, more looking at novel pain target pathway with possibility for disease modification of pain, validation and standardization of methods to measure pain, and also in the future looking at the migraine and headache medicine. So to conclude, IMI is really being created as an ecosystem for innovative collaboration to try to allow really the engagement in a cross-sector and a cross-discipline consortium for really be as always at the forefront of cutting-edge research and provide the necessary scale by combination of funding, expertise, knowledge, skills and resources, and gain from each other and learning from each other. That's really the key thing of our project, and hopefully be transformative to make a difference in drug development and ultimately really for the patient life. And really we do this being a neutral platform where all involved hopefully can work together in open collaboration, sharing all the same challenge. And we hope that in this way IMI will work in pain for the benefit of Europe, for better pain treatment that will reduce socioeconomic burden for patient and society, and hopefully we will have also improved success rate in drug development that will give industry better possibility for contributing to economic growth in Europe. And I would like to thank you very much.